Hello, I'm Mary Lamasney, the Manton social worker for the St. George's Society. COVID-19 closed our office, but it did not stop the important work of the St. George's Society. From the start, we were in touch with all our beneficiaries to assess their safety, food supply, and medical needs. Unfortunately, we did lose four beneficiaries to the virus. By end March, we launched the St. George's Society Food Outreach Program. The intrepid Julie Rosenberg ventured into Costco to secure food and suddenly hard-to-find paper products. She personally delivered them to our most vulnerable in Brooklyn and Queens. By April, we expanded the program to include the Bronx and Manhattan. Our team members, Eliane and Hastings, managed the logistics from shopping for essentials and communicating with a pool of volunteers. It was an amazing all-hands-on-deck effort. This historical event has changed all our lives. What has not changed is the 250-year-old history of St. George's rising to the challenge. I would like to introduce Julie Rosenberg to give a snapshot of one of our beneficiaries in Queens, focusing on what we did for her. Thank you.
Hi everyone, I'm Julie Rosenberg. When I was asked to speak about one of our beneficiaries, I got to thinking about the fact that 250 years ago, when St. George's formed as an organization, one of the main missions was for English folks here in the US to help out their brothers and sisters who had fallen on hard times. And when I think about these past 4 months, what we've seen is just that, members and staff of the society coming together for people in need again. Just to give everyone a sense of what the past months have looked like for some of our beneficiaries, I'd like to tell you about Miss Mary. Mary is an 83-year-old woman from England, and like many of our beneficiaries, she does not have any family. She relies upon a few helpful neighbors and the St. George's Society. In normal times, we help pay a portion of her rent so that she can remain in her apartment of over 45 years. But during the past 4 months, like so many, she's been scared, fearful of leaving her home, especially given her pre-existing health conditions. St. George's included her in our effort to deliver groceries bi-weekly to our more isolated at-risk seniors. We also connected her with prepared meals delivered by the City of New York. She was matched with a phone pal, a St. George volunteer who checked in with her regularly by phone, a program put together to connect members with beneficiaries during this very isolating time. In fact, one day, after speaking with her about the day's grocery delivery, she didn't answer the door, and volunteers were able to find out from a neighbor that she was taken to the hospital. When we reached her at the hospital, she was so relieved St. George's was looking out for her and that we were able to leave the groceries with a neighbor. She's home now. Miss Mary regularly expresses relief knowing she's not totally alone and describes St. George's as a lifeline. This couldn't have been more apparent than last week when she called in a panic because her landlord was claiming she was behind on rent. A mistake by the landlord, but nonetheless terrifying for Miss Mary, who knows she can't afford to lose her rent-stabilized apartment. Due to a landlord error, we were able to provide all the proof of payments, and the landlord corrected the issue, so Mary is able to feel safe again in her apartment. The last 5 months have been tough ones for everybody, filled with uncertainty, fear of getting sick, losing one's income. It's been rough. But imagine that you were dealing with all of these things by yourself without any support system at all. That's what a lot of our beneficiaries really have been going through during the COVID-19 health crisis. So on this 250th anniversary of St. George's, members and staff stepped forward in this very uncertain time when we were all scared, and they asked, "How can I help?" It's so reassuring that those same unmet needs which propelled our founders to create this organization so many years ago continues to move us to help those in need in our community today. And nothing made that more clear than what we have seen in the last 4 months.